talk a little bit, and the first part of my talk is going to be kind of general about the new health law. You may have heard it called Obamacare. You may have heard it called the Affordable Care Act. Regardless, we're going to talk about that first, and then we're going to talk about the Arkansas private option at the end. So I want to make sure to give the big picture, and then we'll talk specifically kind of about what's at stake and where y'all might be able to take some action. So this is kind of what I'm going to talk through, but it's just going to be high level. This is just a good handout to take home with you. So the Affordable Care Act is the law. It was passed back in 2010. It was upheld by the Supreme Court in 2012, and really a lot of the parts of the law went into effect this past January, just a little over a month ago, on January 1st, 2014. And so this, at the state and at the federal level, folks have been working on getting ready for the Affordable Care Act in Arkansas, and it's kind of starting to hit home, and people are really starting to talk about it now. But I want to give just a little background on why we needed the Affordable Care Act here both in the country and here in Arkansas. We know here in Arkansas, 1 in 4 adults, 25% of adults lack health insurance. And that is not only a health issue, speaking to some of our really poor health outcomes here in the state, but it's also a jobs issue. Does the company want to come here and invest in Arkansas if we have a lot of sick folks, if a lot of people aren't healthy? No. So this is that, and it also affects our economy, big picture, when we don't have a healthy workforce. So 25% of Arkansans uninsured. We also know medical bills are a really big part of family economic security. We know 60% of bankruptcies involve medical debt. People who go to the doctor and aren't able to pay their bills. And so we also know that private health insurance companies have had in the past some practices where they turn people. Does anybody know somebody who's been turned down for having a a pre-existing condition? So thanks to the Affordable Care Act, you can no longer do that to anyone anymore, which is a great thing. And so the law brings some protections to people from private insurance companies that have been kicking people off or denying people coverage in the past. So that's kind of why we need the ACA. The second kind of row here to talk through, we know that one of the big things the law does, in addition to these kind of protections that I just mentioned, like pre-existing conditions, free preventive care, things like that, we know that some new coverage options are available for Arkansans if they are uninsured. Now, if you already have Medicaid, Medicare, Our Kids First, TRICARE, nothing's changing. You still have that coverage, and that's not going to change. If you had job-based coverage and your employer doesn't decide to make a change, or your insurance company doesn't decide to make a change, you should be good there as well. But if you're uninsured, you have new options. And again, about 500,000 Arkansans looking for health coverage because they didn't have any. And we also know if you were uninsured in Arkansas, we know about 95% of people who don't have health insurance today will qualify not only for some new coverage, but they're going to qualify for help paying for it under the law. So they may get free coverage. They may get it on kind of a sliding scale. So as you earn more, you pay more. Makes sense, right? As you earn more, you pay more. I heard some grumbles on that one. But as you earn more, you pay more, which is what we want to do. We all want to, get help when we need it and give back when we can. And in the new marketplace, there's going to be an online marketplace, but there are also going to be a lot of different ways, local people that can help you sign up for coverage. And I just wanted to mention also some local numbers. Here in Columbia County, there are about 3,000 adults who lack health insurance or who lacked health insurance before this law came about, and we've already seen a really drastic drop in that, and I'll talk about that a little more at the end. So. We also know with these new plans, so again, there's 500,000 people in Arkansas who are looking for health insurance who don't have it today. Every plan that is available for them through this new marketplace, is what it's called, is going to have 10 essential health benefits. And you're like, what does that mean? 10 essential health benefits mean that every plan is going to cover what you need at the doctor's office. So it's going to cover your prescriptions. Every plan is going to cover your hospitalization. It's going to cover mental health and substance abuse treatment. It's going to cover any transportation like ambulances, EMTs, things like that you might need. So anyway, long story short, it covers all of the things you might need when you go to the doctor. Today, before the Affordable Care Act, you could buy health insurance that really didn't actually cover much of anything. You were paying for it every month, but it didn't really provide you any benefits. So now we're going to make sure that every plan people buy is a good quality plan. So you're like, how much does this cost? Do I qualify? Can I get help? Does anybody know somebody who doesn't have health insurance who could get help? Maybe? Who might be able to? Okay, good. Well, you take this home to them. So, how much you might have to pay depends on a few things, but the most important things are your income and your family size. The only one that really kind of matters is whether or not you use tobacco, and that's the only thing that insurance companies can make you pay more if you use tobacco. But other than that, they can't look at me like they did before and say, you're a woman, I'm going to charge you 80% more than I charge a man who looks just like you. That's what we did here in Arkansas before. They can't look at someone who may have had a backache in the past and say, you know what, you had a pre-existing condition, so I'm going to charge you more than I'm going to charge that other person. Now it's just your age and your income and your family size, and your age also factors in a bit. So that being said, I said 95% of Arkansans who are uninsured can qualify for some help. Well, that help goes up, just to give you an idea what incomes can get help. Up to, for an individual earning about $46,000 a year, you can get help, financial help paying for your coverage. Or for a family of 4 earning up to about $94,000 a year, you can also get help. So this goes up and it covers most Arkansas families who are out there, whether you're working a little bit, whether you might be a student or home with your babies, or whether you're making a lot of money too. So, which is a good thing. And generally, there are 2 kinds of coverage that you might be able to qualify. Number one is what I'm here to talk about tonight, which is the private option. And what the private option is a bipartisan solution that Arkansas legislators and Governor Beebe came up with that allows our state to buy an insurance plan for people who would otherwise be eligible for Medicaid. And so it buys you a private insurance plan. I think here the only one available is a Blue Cross plan. So if y'all heard of Blue Cross Blue Shield. But anyway, instead of getting Medicaid, like where you just get a Medicaid card, you would get a Blue Cross card. And DHS, the Department of Human Services, will pay your monthly premium for you. And for most people, all your other costs, like a copay when you go to the doctor, or a deductible that you might have to meet, those things are all covered for most people on the private option by DHS. So really, most of your health care comes at no out-of-pocket cost to you. And the limit for that, so that's that's for families, for an individual earning up to about $15,000 a year. And you can see the kind of cutoff right here. It's on the table in this kind of bottom right-hand corner. If you're an individual earning up to about almost $16,000 a year, you might qualify for the private option. If you're a family of 4 earning up to almost $33,000 a year, you might qualify for the private option. Now your kids would probably, if you had kids, they'd still be on Our Kids First, just like they are today, like I said. But anyway, so that's good. So then if you're above that, you're going to get a marketplace plan. Good thing about it is if you qualify for the private option, then you got a raise, like we're going to talk about in a minute. You could keep your same plan, but you just have to start paying a little bit. Now you might pay $20 a month when the real cost of the plan was $400 a month. But you're going to get help, you're going to pay a little bit, and then you get another raise. You might pay $50 a month, so that it goes up as you earn more money. And that help, again, goes all the way up to $46,000 a year, or for an individual, or about $94,000 for a family of 4. So again, private option's kind of over here. You don't pay anything, and then as you start earning more, you can get a marketplace plan, and those are kind of on a sliding scale. So as you earn more, you pay more. Clear as mud, right? Okay. So how do you learn more? Because I'm really just hitting the high points today. So how do you learn more? First of all, there is a deadline, March 31st. You got to sign up by March 31st. If you missed the deadline, you might have to wait until next November to sign up. So you want to go ahead and check this out in the next month or so. There are local assisters. Is Evelyn here? Did Evelyn here? Oh, yay, good. So Evelyn is your person who is going to help you, who can help you actually get signed up. I'm not licensed to do that, thank goodness. I am so proud of all the folks around the state who are doing this really good enrollment work. so many details y'all know, and have worked with so many families to get them through the enrollment process. Glad you're doing what you do. So I don't know, will you be around maybe later if somebody wants to talk to you?
Yes.
Okay. And how would they get in touch with you if they want?
We're at the county health office.
County health office. So you can find Evelyn at the county health office. And she every day.
Yes.
Okay.
8 to 4:30.
8 to 4:30 every day, and they can call you and you call up there. And okay. So every community has local assisters like Evelyn who can do that work and who can help you get you signed up. There's also information at the bottom of this page down here. There are some websites if you have internet. There's a phone number, 1-855-283-3483. That number gets you to an Arkansan who's in Little Rock, and they can get you directed to the right place to get you help if you need it. And you also might sign up through, if anybody's familiar with Access Arkansas, where you go to sign up for things like SNAP or food stamps or child care assistance, things like that, you might be able to apply through there as well. But I think the best bet is to call your local person, Evelyn, and make sure that you're talking to a person in your community, because that's what we want folks to do. So okay, so now I'm going to turn and talk a little bit about the private option itself. So there's a handout in your packet that looks like this. It says a vote against the private option will take health coverage from 100,000 Arkansans. So you know I said there are two kinds of coverage you can qualify for. There's the private option, which is basically no cost to you every month. And then there are marketplace plans. Well, the marketplace plans are here to stay. They're part of the national law, the federal law, and they are not going anywhere. Well, Arkansas decided last year to do the private option. And we are the only state, I am so proud of Arkansas because we are the only state in the South besides Kentucky, and I don't know if you count Kentucky as the South, but we're the only state in the South who covered people that are eligible for the private option in Arkansas. In any other state, if you're earning below the poverty line and you didn't already qualify for Medicaid, you do not have a new option for affordable coverage. Just want to repeat how good this is that Arkansas did this. This was supported by more than 75% of the legislators in our House and Senate, and it was truly a bipartisan effort, and no other southern state is doing this. They are leaving people out. Texas has this big Texas Left Me Out campaign going on because a lot of people in Texas are missing out on coverage. Arkansas may be in that boat if we don't all take action. So basically, our legislature every year has to reapprove funding for the private option. And again, every year it takes 75% of our House and 75% of our Senate to do that. Our legislators have to vote for this. They're voting tomorrow in the House. We are looking at a very, very close situation here. And 100,000 people have already signed up for coverage, including about 1,000 here in Columbia County. And they could all lose coverage come June 30th after they just got it January 1. So that would be really tragic, I think, for Arkansas and Arkansans. We also know that ending the private option would leave a really big hole in our state budget. The private option actually brings a whole lot of money from the federal government into Arkansas, which stimulates our economy. It helps our state budget to make sure we can pay for things like education and health care and our kids first and our schools and other things like that, our prisons, everything that keeps our economy going. And the private option also makes sure that our hospitals keep their doors open and are able to make ends meet, because hospitals are facing some cuts under the health law that will really hit them hard if the private option goes away. So that being said, I know my organization, Arkansas Advocates for Children and Families, we've been working to try to tell the story of Arkansans who've gotten coverage. We have kind of a little video series that we've done that has like 1 or 2 minute videos to talk about families who've gotten coverage. They're working families, they're hardworking families. The private option means the world to them, and for that to go away would be a bad thing for Arkansas. So you can contact your lawmakers. I know the panel sent out a great email. Was it Friday? Friday. They sent out an email Friday that kind of talks about how to take action. We have a thing set up on our website as well. So the big points are kind of on here because of the private option. 250,000 Arkansans have the possibility of affordable health coverage. Almost 100,000 are already enrolled. And we also know that kids are signing up along with their parents. Kids who who might have already been eligible for our kids but weren't enrolled are signing up along with their parents. So anyway, that being said, those are kind of the things that are at risk. It's being voted on this week, and we want to keep the private option in place. So, okay, unless